You just don't know how good it feels that you can get up in the morning, put your tennis shoes on, walk around your coves 7 or 8 times for that 30 minutes, getting it in and out, even to the point where your dog even looks at you like, "Hey, mom,
this is enough.
It's time to go. It's time to go. We're missing out this morning.
Right.
You're going to get up this morning."
Thanks for tuning in to Conversations, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South. Conversations include people just like you, living on the bluff, doing what you do to uplift the city of Memphis.
Hello and welcome to Conversations. I'm Betty Lamar.
And I'm LaCresha Chism. Thank you for joining us on our podcast today.
Okay, LaCresha, this is going to be very exciting. It's all about health and wellness.
Yes.
It's all about, I always say, being fit and fine.
Yes.
We have to put the fine in the fitness.
You do. That is part of it.
Yes. So our guest today, of course, is the master.
Yes.
If you want to know what bariatric mean, I learned. A bariatric surgeon is, for those of you out there that don't understand that word, it's the same as weight loss. So make sure you watch this space, okay? Because we are in Memphis.
Yes.
Okay? So, LaCresha, let's talk about our guest today.
Okay. All right. So today we have us joining with us today is Dr. Robert Wegner. He's going to be joining us to talk about weight loss surgery along with his guest. Dr. Wegner, would you like to introduce your guest that you brought on today with us?
I would. First of all, thank you for having me back
Thank you.
on the show. I appreciate everything you guys have done over the years for helping get the word out about weight loss surgery.
Mm-hmm.
So I'll introduce Pamela Lindsey, who's with me here today. She's 58 years old. She had gastric bypass surgery about 3 years ago, and she's lost over 160 pounds.
Wow, that's amazing.
Round numbers. So before we get to this story, let me tell you how we got here today.
Okay.
So Miss Lindsey came in about 4 weeks ago for her 3-year follow-up. And I was coming out of my office and she was in my office at the front, and she had on her a workout outfit, like her gym bag.
Uh-huh.
And we just casually, "Hey, what's going on? How are you doing? Blah, blah, blah." And her energy was just contagious.
Right.
She's like, "Oh my God, I'm doing great. My whole life has changed, and I've lost this weight, and I'm able to do all these wonderful things, and blah, blah, blah." And so I'm like, "Oh my God, that's just fantastic."
Mm-hmm.
And I never really get to hear the stories and see the patients like that. So it's kind of just a chance meeting. And then Betty called or texted me a week later, said, "Hey, I'm going to do the show again. I'd like to have you on to talk. Do you want to bring someone on the show?" I'm like, "Oh my, I just met the
You
best."
knew automatically.
Oh, just immediately, Pamela's like, she was the one. I'm like, this is fate. So I texted her. I'm like, "Hey, do you want to do on the Betty Lamar show?" She's like, "Oh, I really would like to come and tell my story."
Well, wonderful.
So here's Pamela.
All right, Miss Pamela.
Hey, Pamela.
Hello.
I like to take it back to the beginning. Fortunately, Dr. Wegner has been so gracious to have patients on the show with me. So it's been everybody's journey is awesome, but everybody's journey is different.
Right.
Tell us a little bit about Pamela Lindsey. I always ask people, what was your starting weight?
Right.
And what prompted you to Dr. Wegner's office in the first place?
Mm-hmm.
Well, I must tell you, before I even saw Dr. Wegner, at my heaviest, I was 380 pounds.
Mm-hmm.
And this was probably about 4 years before I even saw him. My primary physician, she always told me, "Do you think it's time? Do you think it's time?" I had high blood pressure, high cholesterol. I had already blown out one knee trying to exercise. And every time I would try to do this on my own, I would do the exercises, and then there was an ankle problem. There was a knee problem. I ended up having a knee surgery. I had, like I said, I had the high blood pressure. I was pre-diabetic. But there were other things going on in my life. I'm one of those kind of persons that I just always put everybody before me.
Right.
I had a child in school, and I was running here and there, football games, basketball games. Even after he left our house, going to college and everything, I was still active at his old school. My husband and I were athletic directors for youth sports programs. We were still doing this. So the timing when I had my surgery was just right.
Right.
I had just made up my mind, I'm going to do this for me.
That's right.
Okay.
And when I started doing the whole process, and I want to tell you all that I did the research into the different programs that were available, and the program with Dr. Wegner at St. Francis Hospitals was the most in-depth, I felt, and the most thorough program that I looked into, with all of the support, all of the different procedures that you went through. And when I tell you that they start from the brain all the way
Right.
down, I was just impressed with the whole procedure, the whole
Total well-being.
total well-being. And some people say, well, I don't want to have to go through all that. No, if you really want to do it and you want to do it right, then you must go through this whole procedure of getting yourself ready for this. And we were discussing earlier with my husband, the surgery is just not a one fixed thing. It is part of the whole.
It becomes a lifestyle.
It's a lifestyle.
Right.
And when I was talking to Dr. Wagner that day, when I saw him in the office, and I was saying, well, look at your work. You just did wonderful. And he was like, no. He said, no, you did the hard work. I
Right.
just kick-started it.
Right.
And
Yeah.
but, this man is such a blessing to me. I don't want to tell you.
That's amazing.
And, because he was very honest with me when we had our consultation, because of my BMI when he first was getting ready to do the surgery. He was like, somebody with your BMI, we may not be able to do the whole bypass surgery. We may have to do a different surgery. He says, but we want to get this straight on the front end. And that's one thing I appreciated about him too, is that he was very honest with me. Everything that we went through, he just told me up front.
The importance of the BMI and what all of that means to people that have no idea. And then I want to go with you also, Dr. Wagner. I want you to talk about, she mentioned some of her side effects of obesity. I want you to run us through that, because we don't want this show to end without people knowing if they're, the word you use, morbid obese, how this can affect your body.
Right.
Okay? We'll be right back with more conversation.
All right. Thank you for joining us for Conversations with Betty and LaCresha. We have Dr. Robert Wagner with us today, joining us to talk about weight loss surgery, along with his guest, Mrs. Lindsey. We touched bases on BMI, and we're going to have Dr. Wagner talk to us a little more about what BMI is.
Okay, so BMI stands for Body Mass Index. It's a
Okay.
calculation between someone's height and weight with some coefficients, and you come up with a number. A normal weight person BMI is going to be 20, 25, somewhere in that range. When you start to get into obesity, you start to push the number 30, and then morbid obesity comes in at 35.
Okay.
So I would say, and the world of weight loss surgery would say, that at a BMI of 35, it's time for surgery.
Okay.
In other words, BMIs 28, 32, 30, 31, people that are just overweight or have a mild obesity, those are still what you would call a medical candidate for treatment for weight loss with medications and lifestyle changes, things like that, which I'm sure Mrs. Lindsey had tried.
Right.
And all patients have tried over the years, 5 years, a decade goes by, 15 years goes by, that they're trying to make the changes. They're just not working.
Right.
Once the BMI is at 35 and greater, the data shows that all the diet and the exercise and lifestyle changes and food choices and this and that aren't going to maintain
Right.
100-pound plus weight loss sustainable for the rest of your life. Now, I'm not saying you can't lose weight, but what we look at is longevity and durability
Right.
of
To
a
keep
treatment.
it off.
Yes, to keep it off. So, like when Pamela came in, when we talked, what was your BMI when you came in?
I was over 40.
Over 40.
Over 40.
So,
41,
and I think, did you have some previous surgery, or was this your first
That was
abdominal
my
surgery?
first surgery.
Okay. And so I tell patients, and this is kind of showing, we didn't talk about any of this before. So whatever you say is as interesting to me as to anybody. 'Cause I don't know really. So I really am interested in hearing in a minute how your
So
life
you
has
all
changed.
didn't practice ahead of time.
Well,
Right.
Well, but with I have to quantify this. He was not my original doctor. My doctor left before she could do the surgery.
Okay.
And he stepped in.
The master.
Wow.
Yes, and thank you.
So it's just a blessing.
Yes, it was.
Divine.
So, yeah. So it all worked out.
It worked
Yes.
out.
But yes, her story is compelling. I want to hear it. But back to the BMI. So, I do gastric bypass and gastric sleeve. The gastric bypass, from a surgical standpoint, technical standpoint, is a little more challenging than a gastric sleeve.
Okay.
But it is my first choice. It always is my first choice if I can do it. And thankfully for Mrs. Lindsey, I was able to do a gastric bypass. It is my favorite procedure for long-term sustained weight loss and resolution of comorbidities, hers especially with the prediabetes and hypertension. We're going to respond very well to that procedure, which they have. Plus the weight loss is really the most of all the procedures out there. It's somewhere, I would say on average, around 60 to 70% of your excess weight, which, in total weight terms, anywhere between, say, 30 and 40%, 25 to 40%, somewhere in that range. For comparison, just as an aside, when you hear about these, I'll call them AOMs, these anti-obesity medications, they're hot. They started back with phentermine, way 20, 30
Right.
years ago. And now we're up to the newer ones, which are the GLP-1 agonists like Wegovy and semaglutide and Trulicity, and these drugs we're reading about on the internet and the celebrities
Yeah.
and this
Right.
and that. So
Go
those
low.
drugs,
I know.
those drugs are giving around 15% of weight loss. Surgery is 25 to 40. Nothing is as good as surgery. Nothing
Right.
is as good as gastric bypass or gastric sleeve. Now the medications come close, but there are drawbacks. There's safety issues. There's side effects. There's cost issues, and it's not the magic solution everybody
Right.
kind of thinks it is. And I'm not saying that gastric bypass or sleeve is either. Everything
Right.
requires work and effort and lifestyle changes.
Right.
But from my standpoint, from a surgical standpoint, nothing can compare to the amount of weight loss you're going to lose with a gastric bypass versus anything else. So it's still the gold standard of surgical options.
Right.
And Mrs. Lindsey can attest to that.
Okay.
What I'd like to hear if we have a time is like before surgery, 5-10 years ago, when you were in that maximal, what you said your weight was as high as 300 and some pounds. To now, what are some of the things that, like some of the top, say 1 or 2, 3 things that have really changed in your life in a positive way?
Yeah.
The positive things that have changed, my medications, I'm no longer hypertensive. My cholesterol has gone down drastically. I can get out and walk.
Yes.
It used to be if I went to a mall or something, I get out of my car and the first thing I would do is, once I got in the mall, was try to find somewhere quick
Right.
to sit down.
Yes.
Going to the airport was just an issue. I had to think ahead of time, how much can I carry
Right.
and how far do I have to go to a gate and am I going to be able to make it?
Right.
Just even small things to your body. How many times am I have to go to the bathroom because you're carrying so much weight around your
Right.
waist and all that is just pushing down on your bladder. I mean, I might be getting a real personal here, but
But it's the truth.
It is.
We
yeah.
want to know.
Yeah,
right.
absolutely.
And just the stamina of you just don't know how good it feels that you can get up in the morning, put your tennis shoes on, walk around your cove 7 or 8 times for,
Right.
for that 30
Yes.
minutes,
Yes.
sitting in and out, even to the point where your dog even looks at you like, hey, Ma,
This is
it's
enough.
time to go. It's time to go. We're missing out this morning.
Right.
You're going to get up this morning, it's, my husband has even gotten to the point now he's losing weight because I'm moving. He wants to move.
Oh, wow.
yes,
That's
that's
motivating.
The food, it used to be, okay, where we going today to eat because I just really don't feel like cooking, but now it's like, okay, I got all these different recipes.
Right.
Yes.
now,
Yes.
And, I'm making it happen. And it's just a wonderful thing to know that you're not going to be hurting because you walked across the kitchen and your knees hurt.
Just
Right.
across the kitchen.
Just across the kitchen, and it's just, and it's just small little achievements like crossing my legs
Right.
now.
I see.
Yes.
Yeah, you're doing it too.
Yes,
My
indeed.
heels back on again,
Yes. Right.
And people, you walk by people and you speak to them and they go, hey. And it's people you've known all your
Right.
life, and they like, and I'm with my husband, and they ask him, well, how's Pam doing? She's right there.
Right next to me. Yeah, who's this lady with you?
Right.
It's my wife.
Did you divorce Pam?
Did you get divorced? Is that a girlfriend? What's going on here?
Yeah, exactly. So this is a funny story. So my husband is in this fraternity, and we were all at one of his events. And so I see one of my husband's frats pull him aside, and I hear the conversation. It's like, man, you mighty bold. Where's Pam? Don't you know we all know Pam? You bringing this other woman over? He's like, that's Pam. And I was like, what happened?
What's that tell you about frat? Like we're not going to bust you out.
Right.
We're brothers.
We're brothers.
But I'm just saying, what's going on here? But I'm not going to bust you.
And then the other thing, the other one is you look good. You okay? Everything's okay. You're not
Are you
sick.
sick?
You're not
Right.
anything, But it has been.
That's the thing. Our eyes have changed to
Yeah.
Right.
morbid obesity is like, that's normal. And then when
Right.
someone gets healthy, loses weight, what is wrong with
wrong
you?
with you?
Cancer.
Are you
What is
okay?
something?
Are you sick or are you not eating or
Yeah.
what is
Right.
it? And like, no, I'm just normal, living my
just
life.
living my
And,
life.
So
I'm a normal weight now, all right? You know what I
Okay,
mean?
now this is what we're going to do. This is so good. I'm enjoying
Yes.
this so much. We're going to take another break. We got to pay the bills, right? So we're going to take another break. And when we come back in, I want to talk too about, I'm looking at you, and you look really well. I don't see any, what you call it, Dr. Wegner, when people
Well,
have this
there's going to be,
extra skin.
there's everybody has skin laxity. You know, call
But
it
she
loose
looks
skin.
like a person that if
Right.
I didn't know
Skin
she had
laxity.
she lost weight, I wouldn't know.
Yeah, that you wouldn't know.
Right.
I mean, we're not
Everybody's
running
skin is
around in
different.
bikinis
Yeah.
all the time. Now, if you go to the beach, maybe you're going to see it.
Okay.
But people are like, oh my God,
Always
I'm going to have all this loose skin. Okay, how many times a year are you in a bikini? Well, I never. Then what are you so worried about? You're going to have clothes on.
Right.
It's going to
Right.
be okay. Your life's going to change so much for the better. Don't get so obsessed about a little skin looseness
Right.
or a little skin laxity or whatever you want to call it. It's part of the deal. But
Okay,
you can,
well,
it's a
we're gonna-
trade-off.
Well, we're going to come back, and when we come back, I do want to ask you a question because one of the bariatric patients, they have their Facebook page, and there was one that was having some issues with seeing herself in her mind, the 400-pound person, and even though on the outside she's not. So that's something I definitely want to talk to you about, Miss Pamela, when we come back. I want to know if you still see that same girl.
Yeah, and I want to know what your feel of perception of other people looking at you, what you think they think.
Yes.
Like, are you treated differently than the old Pamela? Like, that's what is
That's
fascinating
what
to
we
me.
want to talk about.
Right.
We'll be right back with Dr. Robert Wegner, the master in bariatric surgery, and Miss Pamela Lindsey. Welcome back to Conversations, a podcast. We have conversations here, and it's all about Memphis and the Mid-South. And of course, we feature top doctors, community leaders, and people just like you doing what you do to uplift the city of Memphis. Today, we have a very, I like to say, intriguing show about weight loss surgery. And oh my God, the master, Dr. Robert Wegner, is here with us, and Miss Pamela Lindsey, and her story is awesome. And speaking of that, I want to jump straight to you,
Okay.
Pamela.
Yes.
Because When you look at yourself now, because you look absolutely stunning.
Thank you.
So when you look in the mirror, do you remember Pamela at 300 plus, or do you really see yourself the way you are now?
Well, I have to tell you, I wasn't always that 300-pound person. The weight came on right after I had my son. I had a very difficult birth with him.
Okay.
And I call him my miracle baby.
Okay.
Because I was on bed rest for a while with him, and then he came born blue. And I had some difficult medical problems after that, and with a bunch of steroids and trying to get my body back into
Okay.
back to normal, what they call normal after that. So after that, I gained the majority of the weight.
Okay.
So before then, my mom was an aerobics instructor. So
Okay.
and I was in the band. I was a major red. I was
Okay.
a basketball player. I was an athlete. So I was pretty much in shape before I had my child.
Okay.
Okay.
So I kept, I fluctuated anywhere from 128 to 150 before I had my child. So this weight where I am now was pretty much the norm for me at that time. So it
Okay.
was not hard for me to vision myself the way I am now.
Okay.
I just never thought I could get back to it.
Right.
But
So you were trapped
Right.
in that body.
Right.
You got into that body because of all these issues with your pregnancy and the birth of
Right.
your son,
right.
which thank God turned out. And now what? He's in college.
He's
And
he's out of college. He's been working now for Amazon.
Oh, great.
Yeah, my
Wonderful.
son is 33 years old.
Wow.
Okay.
Yeah, so
So before that pregnancy, you were normal,
was-
probably BMI 25,
Right.
20-ish range.
right.
And then that all happened. Bed rest, the drugs,
The
the
drugs,
complications, the weight starts to come.
Right.
Yeah, and trying to work out, trying to get it back in the range, but still on all these different drugs and stuff.
Right.
Then I started getting the injuries because I was running. I worked for Vanderbilt, so they had this center called the Guyani Center, where they did all of the.
Oh, you were up in Nashville?
BMI Yes.
Okay.
I did research at Vanderbilt University, and they did all of the BMI weight loss, the water replay, where they put you in the tub and they figure out,
Like the displacement.
the
They
displacement.
figure out your percentage body fat.
Exactly.
Okay.
They did all that. They did a whole system for me to do this, do that, and I was doing it. They lost the weight, gained it back. Lost the weight, gained it back. The
So
whole
did
yo-yo
they ever
system.
mention in this yo-yoing situation, hey, you might want to consider bariatric surgery as a final solution
That
or a more
was-
permanent solution?
They never mentioned that at all. As a matter of fact, they fought against it.
Really?
See, that's what is fascinating to me is at this point, and this was how many years ago?
This was probably my son was born by then, so this was probably about 30 years ago.
Okay,
Okay.
so that is how far we've come.
Right.
Now, it's the standard of care for morbid obesity. The American Diabetic Association has bariatric surgery as the treatment for type 2 diabetes in someone with a BMI over 35. Even with all the medications out there, that is what they recommend. Without surgery, you might as well not do nothing, but you're not going to get nearly the effect of the treatment as if you have a sleeve or a bypass. So that's how far we've come in 10, 20, 30 years.
Right.
In the safety of it, in the techniques and the equipment, and what we can do surgically to change someone's life is it's like from a horse-drawn carriage to the space shuttle. I mean, it's come that much.
Can you give us a little information on the difference between the bypass and the sleeve?
Yeah, quickly. The gastric bypass involves making the stomach, the reservoir where all your food and drink goes, the big stomach part, smaller. You carve off a small piece. You go down at a certain length on the intestine, cut the intestine in half, bring the small intestine up, and sew it to that small stomach, about the size of a tennis ball. Wow. Most of the stomach or the gastric portion is bypassed, which is where the name comes from, gastric bypass. The majority of the stomach is bypassed, and the first, say, 30, 40 centimeters of intestine are bypassed, which is how that procedure creates such a profound hormonal impact on the hormones that control obesity and satiety and metabolism. That procedure is very effective in regulating those hormones. The gastric sleeve only involves the stomach. There's no alteration to the intestine at all. It just makes the stomach real thin and narrow, kind of like a banana versus a football. But there's no alteration to anything else. Again, it's a very good procedure, not quite as impactful hormonally as the gastric bypass, but for overall weight loss, it's within 10-15% of a gastric bypass. So either one of those procedures, depending on what the patient wants or what I think is safe, and we talk about it, and we come up with a plan that's right for that person.
Okay.
But either one, I perform routinely. They're laparoscopic. Just quickly, it takes about an hour to do either one. It's one night in the hospital, and the recovery is about a week.
Okay.
And you're back at it, and your weight starts to come off immediately. When I say immediately, it's 8 to 10 pounds a month for that first year. Did you see that?
Oh, yeah.
It started to just steadily come off.
Amazing.
And I would like to thank you so much, and I'm looking forward to having you back.
Yeah, I think
Yes.
Pamela has to
Yes.
come back.
Yes.
I haven't even touched on half
Right.
the things I want to ask her.
Well, we need to have her on
and-
GHS TV
Yeah.
Yes.
on one of the upcoming shows on my next season. Okay, tell everybody how they can reach Dr. Robert Wegner.
So the website is MemphisWeightLossSurgery.com. I do all my procedures at St. Francis Hospital on Park. My office is at that location. I think the best way to learn about me and the program, and just bariatric surgery in general, weight loss surgery in general, is to just go onto the website, explore it. There's lots of videos to watch and informational videos. There's patient testimonials on there. The contact information is on there.
Okay.
But that's kind of the first step. It is covered by insurance. Did your insurance cover it?
I did not pay anything.
Yeah, which
Wow, good.
now over the
great.
years, I have to admit that's changed. These
Right.
co-pays have gone up, the deductibles have gone up, and you have to work through those things. But for the most part, I would say 90% of the patients that I do operate on, the insurance does cover it, and so they're able to have that benefit. So
Well,
if
I
they go to the
want-
website and look at the options on there, it's a good place to start.
I'm glad you
Wonderful.
wrapped it up with the insurance. But we do want to thank you all so much. And this is something that we could talk about forever and ever and ever.
Yeah.
Absolutely.
Thank you.
Amen. But we got plenty of great content today.
Yes, absolutely.
That, we can really slice and dice and make it a really nice, a full episode, actually.
Yes.
So anyway, LaCresha, thank you so much for being my special co-host today.
It was my pleasure.
Yeah, of course. You're my right-hand girl. And I would like to thank you, Dr. Robert Wegner, for always being there for me.
Thank you.
And I want to thank you for everything that you do to uplift the city of Memphis,
Absolutely.
doing what you do.
I'm more than happy to do it.
I know, and
When
I
I
thank
see
you.
someone like Pamela, it makes it all worthwhile for
promise.
what we do.
Yeah.
And but she's the star. She's done the work. I work for an hour. She works for a lifetime.
That's
All
right.
right.
Thank you.
So
That's
yeah.
wonderful.
Thank you all.
Thank you.
And thanks everybody for watching and listening to Conversations, the podcast. And we're coming to you live from Memphis, Tennessee. Oh, really? And you are?
LaCresha Chism.
I'm Betty Lamar. See ya.
Thanks for listening to Conversations with Betty Lamar. Visit our website, www.thebettylamarshow.com. Email betty@thebettylamarshow.com. Subscribe to our YouTube channel, Betty Lamar Memphis.